Good morning. Welcome, everybody here. And I was waiting for some more of our Wacoma graduates because, of course, the lecture is the opening lecture in the morning is an excellent opportunity. So, and also we planned, as I said yesterday, we plan to have different point of view on the same topic, and this morning we do have certainly a different point of view that we didn't touch during the Wacoma journey, let's say. So I probably was the only one trying to convince you about the importance of organism health. But yeah, we probably didn't go further insights. And today, instead, this morning, this is the important message that Professor William Pan will give us. He comes from Duke University and is really a worldwide known person dealing with the issues of the health and affected by environmental factors. So it's a pleasure I have that Professor Pan accepted our invitation and is here today. And thank you very much. And it's a great opportunity for us.
All right, thank you all. Thank you all for coming. I know it's early. I know when I was a student, 9:30 classes were always difficult to make, so thank you for being here. I actually did have a little bit of a hard time figuring out what exactly I wanted to talk about because I realized that, my training is from a school of public health. I mostly lived in schools of public health. And now I'm at Duke University. I'm in the School of Environment, which is very different from where I got trained and where I kind of grew up in my own kind of academic career. And so some of the things I'm going to be talking about, especially this idea of One Health, is I think a way of understanding and bringing together different disciplines, especially under a flag of health outcomes that is important. And when I walked through your posters yesterday and I read through some of the things that you were doing, kind of what Elena was just saying, I really came to the realization that you guys don't have a lot of exposure to health problems. And the way you conceptualize management of coastal systems and coastal ecosystems doesn't really address health problems. It addresses secondary issues that are related to health, like economic problems and social problems, but those are not the things that actually predict health outcomes. There was one model that did have health on it. This was a migration determinants model, and I talk a lot about migration in my classes and do some of my research on migration determinants and why people move and move around different environments. So that was nice to see. But I would still say that the concept of health is something that is probably not in your program as much as the things that I've been exposed to. So I wanted to kind of give a talk on describing what One Health is and why it's a nice approach, especially if you're a young scientist wanting to become applesauce, as we were talking about yesterday. And working in different places, because I think that the health field itself could really use expertise of coastal environmental scientists. And I would say some of my most impactful research that I've done is from collaborating with people, like Marco Morani, who he and I published a paper this past fall using approaches in hydrology to understand how epidemics actually emerge over time. And it's been a paper that's been highly cited and taken up in the news, using methods from hydrological science applied to a public health problem. So those kind of collaborations are really rich and provide insights that disciplines don't normally see. All right, so let me just start out with One Health, and I'm just curious, just as hands, how many people have actually heard of One Health before? A couple people down here, but nobody up here. All right. So, One Health is not really a new concept. There's a lot of organizations that work around One Health, including places like the World Bank, Lancet, FAO. There's One Health initiatives that are kind of going around all around the world. And there's student One Health organizations, international student One Health organizations. But the idea of One Health is really, it's not a discipline. It's really just a concept and an approach to understand and recognize the fact that humans, animals, and the environment have outcomes and drivers of change that are inextricably linked. They have feedback loops. It requires a systematic approach to understanding and managing problems. So like if you want to understand the problem of, say, some kind of chemical being polluted, causing pollution on a coastal environment, that might be causing an animal problem, either in domestic animals or in wildlife, and that might be spilling over into a human population. So if you want to manage some of those problems, you have to manage that problem from a systems perspective, thinking about humans, animals, and environment, and how they're all tied together. Because if you don't address each one of those areas of the triangle, you might not actually solve the problem that is actually causing issues in any of those areas. So like I said, this is not a new concept on how humans and the environment are related. It goes back to Hippocrates. Even Thomas Malthus, if you've heard of him, wrote about how human population and the environment are tied, thinking specifically about human population in terms of mortality and births. But really, when people talk about One Health, they're really talking and thinking about the origins from Richard Virchow and William Osler. These are two physicians that emerged in the 1800s and early 1900s. Virchow was a person who studied trichinosis in pigs and cysticercosis, which is a pork tapeworm disease, which surprisingly still exists today in very high levels. I have a grant that actually studies cysticercosis and tried to do cysticercosis elimination in South America, Mexico, and Zambia. But Virchow coined the term zoonosis, and he said that if we wanted to understand human health, we actually couldn't draw a line between humans and animals. We have to study them at the same time, because you can actually learn about how to treat humans by looking at how you can treat animals. And animal models today, when we think about testing things in animals, it really comes from this idea that animals can really help inform better ways of managing of different health outcomes. William Osler, you probably have never heard of him before. If you ever come to the United States and if you ever have the opportunity to go to Baltimore, you can visit Johns Hopkins Hospital. He's one of the people that founded Johns Hopkins Hospital, arguably one of the best healthcare institutions in the world in terms of doing research and clinical care. He really developed the clinical training structure that is used still today, where you've got residency and then you sit into different disciplines within clinical science to understand things. But he, as part of that training program, he also established a veterinary pathology program in Canada and tried to integrate the fact that when veterinarians get trained, human physicians should also be trained in the same way, and they should really be sharing information more actively. And that piece has never actually still been taken up. So when you think about, if you get bit by a dog or if you get bit by a bat and maybe you go to the hospital or you see your clinician, even if it's a domestic dog, you would hope, for example, that your physician might check in with the veterinarian and see, what does the dog have for an illness? But usually that does not happen. Sometimes when dogs come into, veterinarians and they might have some kind of neurological illness, there is a strong correlation to what that dog has and then what their owners have. Everything from cancers and lead exposure to different types of bacteria or viral infections. And so these are just things that Again, it blurs the line between the animal and human health, and really trying to think about the fact that we're really tied together. Now, we really need One Health, and Mike had alluded to this yesterday in terms of people wanting to become an apple, and that was his analogy, versus becoming applesauce or apple pie. I forget all the other things that he was cooking up there. But when we think about all the problems that we have today, especially with climate change, the environment is changing very, very fast. But the infrastructure that we have to actually address the emerging threats are not evolving nearly as quickly enough. It's very, very slow. There's a huge gap in understanding how animal and environmental characteristics and surveillance can impact human health. Now, there's a couple of areas of disease that we understand environmental determinants. I study malaria a lot. There's a lot of information about how climate change and malaria are related. When the pandemic began, I was on several panels, either supporting or debunking the relationships between temperature and humidity with COVID risk, especially when we only had 3 or 4 months of data to try to establish that COVID was related to increased temperatures. It was very crappy science, to be honest. But when we think about all of our systems and the reasons we need One Health, it's really because our systems are set up for us to be apples. We're set up to be put in silos, especially as a young scientist. When you join a discipline, you pick a department, you pick a discipline, and you get promoted and evaluated based on how you contribute to that one idea that you begin with. And that tenure process really puts you into a lane. And if you want to get out of that lane very early, you will threaten your promotion process. And that's just the way we're built. Government agencies work the same way. A minister of health, a minister of mines, a minister of environment, they all have a specific mission that they have to accomplish. They all have to go up to Congress in the United States and lobby for money each year, and they have to fulfill their mission. They're not paid to work together. They're not paid to pay for exchanging data across ministries. And that's a huge barrier to improving our ability to manage complex problems. The same thing goes for whether or not you're working in industries, how publication systems work. The last one on language barriers is also a big one. I work with an economist. I don't know if anybody here works with an economist. The economists love acronyms. I've been working with this one particular economist on gold mining and mercury issues. And I swear to God, I think about every fourth word that he uses is an acronym that I don't know what he's talking about. And I always have to stop him and say, well, what's PES? What's this? What's this? What's this? And he will have to explain it because he forgets that, oh, I'm talking to someone that is not in my discipline. And I do the same thing. I'll say something like CDC or WHO, FAO, and for me, those are just common acronyms. But acronyms can be a huge barrier to collaboration. Now, when you think about One Health, almost everybody thinks about zoonotic disease, how animals impact human health, everything from the bird flu H5N1, the bat coronavirus story about how bats somehow entered the Chinese market and caused us to have this outbreak of coronavirus. There's something called Nipah virus, which is primarily in South Asia. There's cysticercosis, Lyme disease, Ebola. All of these are examples of zoonotic infections where One Health has a very strong history to explain how animals and the environment are impacting human health, and trying to say that when you manage these problems, you really have to come at it from a very much a systems perspective. But in reality, there's a lot of areas in need of a One Health perspective in terms of management. And this is just a small list, but just to kind of highlight a couple that I think are relevant to a coastal ecosystems. I mean, I think most of these are probably related to a coastal and water management perspective, but antimicrobial resistance, which I think some of you might have heard about. This is the idea that you have multi-drug resistant Staph aureus, where you get these little bacteria infections in your skin and they're untreatable with antibiotics. They can cause infection in your blood, causing sepsis, eventually causing your heart to stop, or you could have surgery to remove some infected areas of your heart. But antimicrobial resistance is usually thought about in terms of, say, large-scale pig or cattle operations where farmers are using antibiotics to increase growth in these animals. You might think that's bad, but everybody here uses antibiotics, and antibiotics have actually increased heights and weights in people as well, so you actually see that effect since it helps clear infections and allows us to actually absorb nutrients more effectively. But fish production has actually now been identified as a major source for antimicrobial resistance emergence. Not just the production of fish meal, but actually the use of fish meal in a lot of these fish farms that occur in different fisheries around the world. The environmental health problem, so on the very bottom, there's the environmental health, chemical fate, and transport. There's a lot of examples of this. You know, I do work on gold mining and mercury exposure. If you think about, you know, I work mostly in the Amazon, so gold mining is the #1 source of mercury emissions in the world. I don't know if you knew that. I didn't know that before I started studying it. So all the gold that we produce, about 20% of it is coming from illegal artisanal gold mining, and it's filtered into our markets illegally. But how that enters our environment and how we're affected by it, every time you go eat fish in the ocean or fish from a freshwater source, you might have read, you know, don't eat swordfish or don't eat shark, don't eat tuna because it has high levels of mercury. Most of that mercury is coming from gold mining. And it's coming from areas like the Amazon, parts of Africa, parts of Asia, where mercury actually cycles either through the atmosphere and settles into the ocean or a terrestrial environment, and then eventually, because of erosion, goes into a watershed, and then filters out back into the ocean and into the watershed, and then it bioaccumulates in our food chain. So these kind of things, this is a classic One Health example of how environment, animals, and humans are impacted by chemical fate and transport. And then the healthy soils, healthy microbes problem. This was an article in The Atlantic talking about how the microbiome of the soil is highly correlated with how healthy a plant will grow, how well fruits and vegetables will actually have yields and produce strong nutrient quality. So one of the things I've always noticed when I come to Italy, and I used to come here all the time pre-pandemic, is that the tomatoes here taste a lot better than the tomatoes that I eat in the United States. The tomatoes in the United States taste like cardboard. I mean, they literally don't have a lot of taste. And of course you come here and it's a different taste. And it's better. But so I always wonder, you know, what's the soil microbiome look like? Is there some kind of better fertilizer that they're using here versus places that I'm getting my tomatoes from? Or is it the fact that in the US you have some mass tomato producer and they just use a different type, they have a different types of soil that produces a different taste? So all of these things matter. And all of these things and how we manage different problems using One Health can really, we can really benefit from this. All right, I want to give you a few very fast examples of specific things that I think that you might be interested in hearing about, especially from a coastal and water management perspective, things that you probably not have thought about. So this is a One Health use of animals as sentinels. So animals as sentinels means that you're using animals as kind of an indicator of when health problems might be emerging. You might have heard of the term, what is it, canary in the, what's it called? I can't remember the term. Canary in the coal mine. Canary in the coal mine, that's what it is. Where you're actually sticking an animal in some kind of box to figure out what's going on. And we actually had a study on tuberculosis where we used guinea pigs and we stuck them in a, and this was in Peru, where we built this ventilation system and had guinea pigs in a little a hospital ward where the ventilation system was attached to the tuberculosis unit in the hospital ward, and we wanted to see how many guinea pigs actually got tuberculosis based on airborne transmission. So that's the same concept. This one is about PBDEs. So you might not have heard of PBDEs before. These are flame retardants. They probably exist in all the furniture, all the carpeting, all the walls that are in this room. It's something that entered in our manufacturing about 40 years ago. It's still legal in the United States. I believe it's still legal in the EU. It's a highly effective flame retardant. The problem with PBDEs is that they are highly correlated with thyroid disease. And you can see this very prominently in cats. And usually feline hyperthyroidism is something that you see very often in areas that there tends to be more dust and other types of dirt that's produced in areas that have a lot of PBDE use from the materials that we have, that we use every day. There's been studies of this. There's a woman at Duke named Heather Stapleton. She's one of the world experts on this, and she studies flame retardants, and she actually has a core center where she takes any material you want and you can ship it to her, and she will test it for the levels of PBDEs. So people have been sending her things like baby blankets, what do you call the little things that the babies suck on? I forget what the term is. What is it? Pacifier. I see my daughter's like 16, so I can't remember the name of those things anymore. But you can send her all sorts of materials, and she will test them all for PBDEs. And this problem is particularly important for One Health because we see these health problems occurring in animals and the pets that we have. Heather has done some research in children, in pregnant women, and very young infants, looking at serum levels of PBDEs, and she's still following these cohorts to see what kind of health problems emerge. They are expecting things like endocrine disruptors, meaning that the children won't develop sexually very quickly, or they'll have stunted growth. They might have other types of health problems emerge, like thyroid disease or liver disease, all sorts of things that they're looking at which are caused by this exposure. A similar one are PFAS. So this is something that has kind of hit the news quite a bit recently. These are called forever chemicals, and you might have used them when you cook. So if you have a pan that is a nonstick pan, or if you've ever sprayed anything on, clothing or furniture that you don't want to have a stain, those are PFAS chemicals. Those PFAS chemicals are also related to lots of different health problems, liver and thyroid disease, cholesterol, obesity. They're endocrine disruptors. They're related to cancer risk. And there's been a lot of work, again, on understanding the link between how animals, our domestic animals that we have, and the health problems that are emerging in them, and whether or not we're going to have, as humans, the same types of health problems. Again, so these are just animals as sentinels. Another great thing that we use in One Health is something called comparative medicine, and there's another example of this about disaster response. So comparative medicine is amazing. So on the left, you've got a dog that's from University of Pennsylvania named Olin, and you might have heard of dogs used in this way, especially for COVID or in diabetes research. But apparently, Olin was trained to detect ovarian cancer, and this dog can actually sniff out early signs of ovarian cancer in women. Highly effective at doing it. Pretty amazing. Glioblastoma multiforme is a form of highly invasive cancer. It's what John McCain, the Senator John McCain, died from. It is actually the exact same etiology and exact same clinical course as glioblastoma multiforme in dogs. So there's a lot of research in trying to understand how to treat this type of cancer in animals and directly apply it to how we treat the same disease in humans. Another big one, of course, in coastal environments is food and water safety. And there's thousands of examples of this. I'm only showing you one. And this is one that really emerged from the pandemic. And I knew this happened in the United States. We've had these major outbreaks of different diarrheal diseases, either Salmonella or Campylobacter. Salmonella, if you're not aware, it's also a typhoid disease. It's a major problem globally, but during the pandemic, people started buying chickens and putting them in their backyards so they could have their own eggs. The problem is that most people don't really know how to take care of their chickens or to be safe when they're handling chickens or handling the eggs. And what turned out was the fact that there were major Salmonella outbreaks throughout the United States. I looked up the European CDC, and apparently the same problem occurred. There were major outbreaks of Salmonella that occurred in different parts of the EU. linked to poultry production. The other thing that happens with poultry production is Campylobacter. So all of this occurs, by the way, mostly in chicken feces and how you handle chicken feces. Campylobacter is slightly different from Salmonella because Campylobacter survives much longer in the environment. It can get in the water, it can get attached to food particles, and it can survive much longer than most other bacteria. So it's very hardy. It's not as clinically devastating, for example, as Salmonella, but it does cause diarrhea, and it's not a very pleasant thing to have. And kind of the last example I wanted to give you about One Health was disaster preparedness and response. And if you think about things like Hurricane Katrina, the tsunamis, the earthquakes, we have a lot of lessons on how animals are really important to this response. On the one hand, if you looked up animal rescue for any type of flood, and it wouldn't matter if it's in a developed or developing country, every single response that you have for a disaster needs to have pet carriers, because people care about their pets. And there's always stories about how a rescuer saved an animal's life. Those are feel-good stories, of course, but it still doesn't negate the fact that pets are an important part of human civilization today. So saving our pets is an important piece of disaster response. So we need to make sure that we save them. And actually, where I live in Raleigh, North Carolina is the capital. So Raleigh, Durham, Chapel Hill. I live in Chapel Hill. Duke is in Durham, North Carolina. Raleigh just made this new ordinance that was passed, I think, 2 weeks ago, saying that exotic wild animals are no longer allowed to be kept as pets. Part of that is because of the worry about disaster response. Part of that is because a person actually lost an extremely poisonous cobra that is loose in a neighborhood, and they still can't find the cobra. It's still hitting the news in Raleigh. But nonetheless, pets like snakes, for example, still have to be saved, so people need to understand how to handle all sorts of different animals. Animal search and rescue is a big one. Animals are always used to improve our ability to find find humans who are trapped in different types of debris. During the Japanese tsunami, the dog on the lower right was actually fitted with this high-tech vest with GPS and different things that the dogs could bring to people who were trapped to help the personnel actually find people and help them survive in different areas before the response could actually reach them. So that's One Health as a very broad overview. And I want to switch gears to coastal issues specifically, but before I did, I wanted to make sure, did anybody have any questions about that? I can take like one question. So make sure we don't go over time. Yeah. Huge one, huge. That's a major one, and I didn't include that one. I actually deleted that slide. So, animals have and provide a lot of comfort to reduce anxiety, but there's also mental health issues in the sense of understanding, say, lead or mercury exposure and depression in animals, and then depression in people. I'm showing the same kind of exposure. But yeah, there's a very strong link between mental health in animal care and human care. And there's lots of examples of that, but I just didn't get into it. But that's a big one. Thanks for asking. Yeah. So if I understand the question, you said there's a perspective of animals as disease vectors, animals as a way to treat, et cetera. And then how do I view those different perspectives? Well, so humans can be vectors, and humans can be treating other humans. I don't say that humans are different based on one person's a risk and one person's not. It's still part of a human system and that we have to manage in different ways. Animals are the same way. So you have wild animals, you have domestic animals, and then we have animals that we raise for consumption. All of those populations require management to improve health conditions of those populations to make sure that human populations also have maximized health outcomes. I would say that management of, say, disease and infections in animals is critical. The surveillance that's done in animals is very poor. It's not openly shared, yet, for example, in the United States, there's something called the Banfield, which is, I don't know if you know this company, but it's called Petco. They actually have a database of Lyme disease testing in dogs and cats. And if you mapped out, and they allowed some researchers access to this database, but if you mapped out where the Lyme disease cases were in dogs and cats, there's a direct spatial correlation and temporal correlation to where human Lyme disease cases are in the United States. And Lyme disease is caused by a tick. But I would say that, I don't really view them as different. You have to manage it. They're all manageable issues that we have to think about in one system. So it's not something that I differentiate in any way. I hope that answers your question. All right, let me go on. So I'm not a coastal expert. I don't study coastlines, but I know that I teach a lot about who's at risk of different health problems. So my first question when I started thinking about, what are the health problems that exist in coastal areas? My first question is, what is a coast? We have a new study that we just started in Guyana about 1.5 years ago. And after visiting there and kind of seeing the lowland areas, I realized that the concept of coast is not exactly what I originally thought it to be. So when I listened to some of the talks yesterday and read some of the posters, most of the assumption is that coastal management and coastal problems only exist on the coastline and people who are living on the coast. But if I think about Guyana, which, if you don't know the history of Guyana, it was technically a Dutch colony and then a British colony. They had a lot of problems with erosion. In the 1800s, the Dutch and the British ended up building, not together, separately, but in different phases, built this huge seawall, about 280 miles long, to prevent erosion. The seawall worked wonderfully for decades. All of a sudden, we have climate change and sea level rise. It is no longer adequate to hold back the tide. And the map on the upper right shows you the elevation zones. Does my mouse work here? I don't know if you can see my mouse. But if you can go, say, 100 miles inland, you are still only about 3 meters above sea level. And so if you have just a 1 or 2 meter increase in sea level, most of Guyana will come underwater until you hit the mountains. The problem with this is that 80% of the population in Guyana lives somewhere in a coastal, low-lying area. Most of the economic activity of Guyana is tied to those low-lying areas, including almost all of the agriculture production. And the way they have tried to solve this is to say, we need higher seawalls, which they can't pay for, or let's move the capital, Georgetown, which is right on the coastline, let's move it inland. And their idea is to move it to Linden, which I don't know if you can see on the map over here. It's approximately right there. Still is going to be underwater if they get enough sea level rise. And all of this is kind of, these are policies that are made in the backdrop of the fact that oil was just discovered, a huge deposit of oil equal to about the size of what Venezuela has. So Guyana will become the next major oil producer in the world. They have an immense amount of gold that is tied to different terrorist organizations, so you can't legally buy Guyanese gold, but they used to filter it out through Canada. Now the Canadian bank has actually stopped being their kind of gold middleman to get it out of the country. But they still have this immense amount of gold that it still hits our market. And beyond Georgetown and Linden, there's really not any good roads to travel inland to actually establish any communities. So Guyana's in big trouble when it comes to sea level rise and trying to understand how to manage it. When I thought about coming here, I'd never been to Ravenna. I've never been on the eastern side of Italy, which is my fault, right? I should have come here earlier. But the most amazing thing that I realized when I flew into Bologna and I took the car down to Ravenna was how flat it was, right? So when I thought about the coastline here, at first I thought, oh, Ravenna's right on the coast, I want to go see the beach. But in reality, it was so flat, I started looking up these other maps, and these are low elevation coastal zone maps. These were made by Columbia University, Deborah Balk, and McGranahan, which I forget his first name. But they mapped out the entire planet in 2007. They redid it in 2021, trying to identify low elevation coastal zones in places where that were at higher risk of coastal flooding because of sea level rise. And what they defined was, in the dark red are areas that are 0 to 3 meters above sea level. In the orange and the tan are 4 to 7 and 8 to 10 meters above sea level. And they define a low elevation coastal zone as anything that's under 10 meters above sea level. So anybody that is living in that zone is technically at risk of some kind of coastal problem, whether it's flooding, development, or whatnot. And then what they did is they actually mapped out to try to calculate how many people actually live in these zones. And there were lots of interesting things from their original 2007 paper that they updated in 2021. But the point is that you can actually live 100 kilometers away from the coast and still be at very high risk of any kind of coastal flooding event. And you can actually download this data yourself, and it's all for free. Here's the link. I'll share this presentation afterwards if you're interested in learning about it. But if you look from 2007 until now, the most important finding that they have from the 2021 study is that people are increasingly moving to coastal urban areas. And that's an important concept here. And this is the table, the summary table. Basically, they estimate that there's 815 million people around the world that live in these low elevation coastal zones. That's about 11% of the global population. I will mention that this is from 2015, so they're only putting 7.4 billion people on Earth, where we're going to hit 8 billion next year. So I think right now we're about 7.7 or 7.8 billion. Regardless, they found that big, fast growing urban areas are the places that are absorbing most of the population growth. They are finding that people are tending to move to these urban areas that are along coastlines, and these are the areas that are at greatest risk of some kind of coastal event. And if you look at globally where people actually live in these kind of strata of low elevation coastal areas, about 36 or 37% of people live within 5 meters above sea level. So residential population is only one aspect of being at risk of a coastal flooding impact. What do you think are the other aspects that make people vulnerable to a health problem or some other kind of problem who live on a coastal zone? What are the characteristics that people have? Does anybody want to shout out any? Since we don't have a lot of time, I won't wait. This is not a lecture, sorry. But there's 4 general categories. People with disabilities, people who are immunocompromised, anybody with a pre-existing condition, minority communities, places that are poor communities and poor families, low-income groups, unemployed, uninsured, pregnant women and newborns. They're in green because these are people who are highly sensitive to relying on local infrastructure. And if you have poor local infrastructure, that means that you are going to be adversely impacted by an event that people who actually have access to resources can respond more effectively. The groups that are in green have a lower ability to prepare for an event, and they have a lower ability to respond once the event occurs. And you can see that when Hurricane Katrina hit, the tsunamis, earthquakes, whatever. It doesn't matter what problem occurred. You always see that. The other groups that are affected are first responders and emergency workers, because they have to go out and put themselves at risk to help others. And then anybody who really works in an outdoor occupation, primarily because they're involved in cleanup and they're at risk of injuries. So there's a lot of coastal health risks that we have. I put drowning #1 in red because this is the #1 cause of death. Okay, I'm almost done. But there's a lot of other problems that occur from coastal health risk exposures. I would say that the top group are the immediate problems that we have from coastal events, and the bottom ones are things that usually occur over a slower, longer period of time, either from gradual coastal development or other things that happen after a coastal event. But some of these are things that you would normally think about, like waterborne or vector-borne diseases, mold growth, and you mentioned mental health and PTSDs, and those are both there. So the question is, how are we managing our coastal environments, and how are we doing it in terms of managing health problems? And what I would say is that, in general, we are not doing a great job. This is definitely true in the United States. This is true generally in other parts of the world, especially when we think about sea level rise. But this is not a problem that is unique to just coastal management. Coastal management is a complex problem with complex issues that you have to manage. When we think about humanitarian response, it's the same thing. And the question is, why do we have this problem of managing problems, complex problems? Laura Kahn, who was a One Health expert, wrote a book in 2007 about who's in charge and how leadership and relationships are critical to responding to either epidemics, bioterror attacks, or other types of humanitarian crises that we deal with. She updated the book in 2020 following the COVID pandemic, and basically, both from the book and from my own realizations, I view us as being in a period of time where politicians really lack, they seek visibility, but they lack expertise to talk about things. Scientists, me included, we are still sitting on the sidelines for the most part, not being involved in policy. Journalists want to communicate headlines and one-sentence pieces of information and not news. The public is completely confused about what to believe and what information they need to have. And in the end, relationships, whether or not it's between scientists and politicians, scientists and the public, politicians and the public, journalists and the public, the relationships are not managed. We don't trust each other as much anymore. I don't even know if it's anymore or not. Maybe we never did and it's just gotten worse. But we really have this crisis of leadership and relationships. And I wanted to make a point about, from a health perspective, another problem with coastal management is this idea of how the health infrastructure is set up. The US NIH has a $41 billion budget. Most of the way this is divided up is by disease area. These are just a couple of them, and these are in millions of dollars. So the lowest level funded areas are things like vulvodynia, vaginal cancer, DES, neck pain, which get about $1 to $3 million per year. And then you have things like malaria, coronavirus, substance abuse, where they're getting about $1 billion or $500 million per year in terms of research. If you think about the way health system itself is set up, hospitals, you go into a hospital, you go to endocrinology, you go to internal medicine, you have different divisions in a health hospital. They don't talk to each other. Some hospitals have electronic health records where they can actually share information across departments, but for the most part, it's a very siloed way of managing our health. And like I said before, the training structures are also very siloed. Hopkins, where I used to work, arguably the #1 school of public health, you have to choose a program, and then you have to choose a department, and you are immediately put into a lane. And so if our funding, our training, and our health systems are all siloed, how do we even begin managing some of these multivariate problems? The way we do this, in my own perspective, is to begin taking this One Health approach. This is something that WHO, OIE, and FAO have all signed on to. The United Nations Environment Program also signed on to it, so it's called a quadripartite. So, like I said in the very beginning, if you are a coastal management or water management expert and you want to join something that is very interdisciplinary with a policy impact, this is a place where you have to start looking. They are going to be recruiting and creating competencies for people for getting trained and creating first-line responders with training in One Health. This gets a lot of support from the G20, from the G7, and I put these pictures purposefully because one is of Trump actually supporting it, and one is of our friend Boris also supporting it. Both, controversial people who actually support the One Health concept. But this declaration in Rome that was signed last year really highlighted the fact that One Health is going to be a key part of managing our health problems in the future. Where do you get this training? There's not many places, sadly. There's one PhD program at University of Florida. There are a lot of veterinary colleges that actually offer One Health programs, but in terms of undergraduate master's training, there are not degree programs that exist yet. The ones that do exist all exist in schools of public health, nothing in schools of environment or other types of places. So sorry I went over. The bottom line here is that we have complex coastal ecosystems that we have to manage. We can't do this from a one perspective. We have to do it from a multidisciplinary perspective. The conceptual models that we have right now, based on the ones that I was reviewing outside, don't really integrate health as an entity to manage, which I think is something that needs to be taken into account. But even in epidemiological research and public health, we don't really have the ability to work across disciplines. So there's a lot of constraints in the system that we still have to overcome. So hopefully One Health can be a solution, and I hope that I convinced you of that. So thanks.
Maybe it works, probably, yes. So thank you very much. I also had message from people online enjoying your talk. And I thank you for being there. I'm sorry that the previous questions weren't made on using the microphone, but we were kind of unprepared. And I enjoyed very much this lecture. Every word. Actually, I hope the students can go back to my course, which is too early maybe, but we were speaking of, not in this beautiful way, but I tried to speak you about these issues. And I agree that maybe One Health is already a concept that is not underlined everywhere, but then I see that especially at the University of Bologna there is something good coming. What I see is again a big distance between veterinary physicians and the environment. So we have to build this bridge, and because we used to study and to talk on our own discipline, so it's getting a little difficult. So thank you for this. If there are a couple of questions, we can take them, even if it's a bit late, but I think it's a lecture that can deserve.
Hello, good morning. Thank you for your presentation. It was very interesting. I was the wheel that you showed. I'm the Chesapeake Bay that I did that. And even though it doesn't show in the wheel, that was the categories and then the subcategories, and one of them was health. And I took a lot of indicators of health, like water and resilience and social well-being, and I found out that in the United States, this is very linked to your race and to your socioeconomic status, which was very sad. I had to stop sometimes. So I realized that this is very particular from US, but I'm not sure if it's the same in other countries. Have you find something, the same thing happened?
You mean the relationship between race and health outcomes?
Yes, like if that's
Yes.
the minority, like
Yeah.
you said in your presentation, I just found for Chesapeake Bay, just for the watershed.
Yeah.
So I'm not sure if it's the same case. It sounds like it, but
So
maybe.
I don't know about Europe because I'm not familiar with the research and how how the information is collected here. In the work that I do in Peru, Ecuador, Brazil, there is a strict, significant difference between health outcomes in indigenous and darker skinned populations versus kind of the European white, Caucasian population. Everything from exposure rates to different chemicals and metals, to malaria, to access to health infrastructure, mortality rates, infant mortality rates. There's huge differences. So yes, that you definitely see that in different countries.
Thank you.
Yeah.
Hello, Professor. Thank you very much for this presentation. So my question is also related to this part of the health indicators, because as she was saying that we used some indicators within the categories. And in my case, I used a few indicators which are proxies, but as you mentioned, it's true, like they are not really measuring health. Like I used, for example, the risk of water consumption or food nutrition. But I'm wondering if there is one indicator that you would suggest that has to do directly with the health of the people, but in a kind of general way, that it doesn't really focus only on one particular illness, but just like in the general health of the people in a particular area.
I would say it depends on the country you're talking about and the problem you're talking about. Infant mortality rates are usually the best indicator of health infrastructure and access to health resources in general. Countries that have very low infant mortality rates tend to be the very rich countries in the world with relatively good access to healthcare and good nutrition, right? But I don't think there's one variable I would say that's ideal. There's probably a lot, but there's not an index of health quality, for example. Yeah, there's not one. Yeah.
Good. Thank you for that.
The last one, yeah.
So, once again, thanks for the presentation. It was very nice. A couple of years ago, I went to a lecture where they talked about microbiomes. So pretty much how the environment you live in affect your gut composition and how that actually changes since minor health issues to mental health issues, as I was asking before. So do you think if there is something being done in terms of climate change, how it relates to different environments or affects different environments,
Yeah.
and how the microbiome of people would be affected? Just like out of curiosity, if you know something about this.
Yeah, so just to kind of give you an example, I mean, I didn't get into this in the example with the soil microbes, for example. There's research in the Amazon where I am where it shows that deforestation and places that have seen changes in temperature and increased drying result in less healthy plants that are growing, particularly the trees, right? So the NDVI measurements from a satellite image are showing, less production of chlorophyll in the trees. That's an indicator of the fact that, the plant health is suffering. But when people are taking fish from different populations, there's a study of fish that looks at fish in these areas that are impacted by deforestation and, say, more harsh conditions of the climate and the hydrology versus the areas that are more pristine. And they're finding that omega-3 fatty acids that you get from fish are higher in the places that are more pristine and untouched versus the places that are damaged. Exact same species of fish. Now, is that microbiome? It might be microbiome. It might be related to how fish are absorbing nutrients in one area versus another. It might be a difference in the food that fish have available in one area or another, but it definitely still affects the microbiome of that fish. And when you're consuming that, it's affecting your microbiome. Because if you're eating a fish from a healthy area, that's going to end up being a better thing for you than eating a fish that's produced in a less ideal situation. But we don't all want to get all of our fish from the perfect conditions, right? We can't, right? That's impossible. But it's just to say that climate is driving changes in the food that we eat. How we understand that in terms of how it's linked to microbiome is an area of research. I don't think we can say anything definitive about it. Thanks.
Thank you very much. Thank you very much. It's been a great lecture. Thank you. And yeah, if I can comment, microbiome will give us many answers on what is going on. We are trying to do something with plastics, microplastics in the intestine or whatever. And I think we will get several answers from the microbiome. So we move quickly to the next presentation, and is by Marco Marani. He is a professor at the University of Padova, and he will speak actually about extreme events. But then, as you have understood by Dr. Pan, they collaborate. So that's is something very to consider very important as an example also for who is dealing with the environment, who is dealing with health, human health in this case, so to start building these bridges. Thank you.
Good morning, everyone. It's a pleasure to be here. Thank you for the invitation. Also, it's great to be speaking with such a diversity of colleagues working in different fields. I'm now at the University of Padova. I used to be at Duke University, and with Bill we collaborated, and that's an example of, I think, what Bill has been advocating for, and several people have been advocating for interdisciplinarity, and I think Wacoma is one of these, embodies these ideas, so it's really, really nice to be here to talk about something slightly different, but we'll see. I'll get back to health in the end, and show you how we can use tools that have been developed for other purposes to also address that type of problems. So extremes, and I added, after the abstract book was printed, an important connotation. Really, we need to talk about extremes, which are under our eyes constantly in the framework of change. Change is probably the main characteristics that you will have to face in your professional life, and that is increasingly recognized, but maybe it can be traced to this baseball player that probably Bill knows. I've learned about him after he quit. He came up with some great quotes. One of these is, "The future ain't what it used to be," and really, the future is different. It's going to be different. It's different, increasingly so, different from what you've experienced in your life, and different from what you've been taught. And this is a major aspect that we all need to consider, and that you will be facing more and more. I'm sure I don't have to convince you here, since what you've been studying, of the importance of change, and the reality of change, and the reasons of change. I will show you some examples that clarify how important it is to include change in what we do, in the analysis we do. And believe me, we talk about climate change all the time. We study the reality of climate change and environmental change, but the tools to deal with it are still to come, and I'll show you that. So, water. I work with water. I'm a hydraulic engineer originally, working with water resources and coastal change. Water has been a major driver of civilization, and this is northern Egypt, and this is the Nile River. And this is one of the early documents that clarifies how our societies have always dependent on just the right amount of water, no? It's, you see here the green area. If this is the scale here in Ls, is whatever the unit is the level of the max flood in the Nile River, annual flood in the Nile River. If you're in the green area, things are just fine. You know, security, abundance, happiness, even if it's a little lower. But if you go slightly lower, then that's where the problems start to begin. Or if you go slightly above or a lot above, that's where problems start to begin. So we need just the right amount to avoid hunger and to avoid disaster on the other side. So it's always been with us, with human societies, and this is one of the earliest records in hydrology. I'm a hydrologist, and hydrology enjoys some of the very long data sets, and this is reconstructed maximum flood levels in the Nile River from one of these nilometers, famous for some classical papers on persistence and which have changed the way we look at these processes. But anyways, I'm using it to define one important concept that we will use. So bear with me just a couple minutes to understand return time. You should be familiar with that. It's something that we use to identify, to label how extreme is an extreme, okay? We say return time, 100-year return time, and 1,000 years return time. What does it mean? Return time is the average time between two values that exceeds a certain threshold. So the threshold can be the threshold for disaster, all right? And so if I look at this record and I draw a line, this is my threshold, and I look at the times it takes between these disasters, so to speak, okay? And then I take an average. And the average is an important thing. So return time is the average time between disasters or between exceedances of a threshold that may be of interest. It does not need to be disaster, really. But it could be, you know, a river exceeding bankful level, or it could be, on the other direction, a reservoir lower than safety level, right? Which means I'm running out of water. But if I lower the threshold, then clearly I have many more exceedances, and the return time becomes slower. So lower the return time, the more normal the extreme. The higher the return time, the more extreme the extreme. All right, this is an important label that we use all the time, and I will be using it in the examples that I'm showing you. Okay, don't read it. Just, it's a model. We need a model for extremes. There are several around. This is what I've been working on for some time now, so I've just put it there. We're not going to try to understand it. We don't have enough time. What I'd like to point out is that the return time that we use so often, and you will be using all the time in your profession, is linked to this mathematical model. Okay, so if you fix TR, you can work out X. So if you say, oh, I want to build this levee high enough so that it's exceeded on average only once every 100 years, then this formula will give you the level that you have to build your levee, right? And so just to make it clearer, how big should the reservoir be, or the levee, or the seawall that we've seen in Bill's example. We set the return time. So TR is a number that somebody decides, okay, you or the regulators. Fit a function here, a model. We won't worry about what it is. And then we use this formula to get X. This is the starting point of any mitigation measure, right? We need to decide how tall the seawall is going to be. And graphically, we have data, the red dots, the red circles, and we fit some mathematical model, this blue line, and then, because the data usually cover small periods of time, there's a leap of faith here. We believe the mathematical model because we need to estimate this long return time event, all right? So we have to trust the model here, and there are several out there. So it's an extrapolation that we need to do. So we will see this process applied to different phenomena, okay? So data, model, inference of the extreme, all right? We'll do this several times. And note, we're relying on data, clearly. Whatever we do has to rely on data. Remember the opening statement, the past is not necessarily a reflection of the future or vice versa. So we will need to discuss, do these red circles represent what's ahead of us? And I will try and convince you that's clearly not the case, and we need better ways of accounting for that. So this is a very long series of observations, the longest in the world, to my knowledge, started in 1725, daily measurements of rainfall in Padova. The record continues to this day, so it's a nice place to start to look at, test, what's been happening. And if you do what I showed you on 30-year windows, so say you're in 1919, and you pretend you don't have the whole series, you only have 30 years, the previous 30 years, the last 30 years before 1919, so that's the green interval, and based on that, you have to estimate your extreme, 100-year return time flood or whatever, in this case, daily rainfall. So the result of your analysis would be the green dot. Now, if you're an engineer, if you're a planner, that's the value you will use to build your levee, to build your seawall, whatever you need to do to preserve, to protect, human infrastructure, people from extreme events. But the reality of things is that if you're building that infrastructure will be exposed to very different extremes. The blue curve that you see there is computed on the extremes that came after 1919. So we are now doing it completely wrong. Now there is no country, actually we start incorporating some allowance for climate change or for environmental change, but it's very sketchy. In Italy, there is no regulations that tell you, oh, look, the future is going to be different. You cannot build a bridge that high. You have to do something different. You have to build it higher, so on. So there is a variability, a change in the future that awaits us that we need to be able to account for. And that's true in so many cases. So I will now go a little faster on other examples. This is related to Venice. I've been working a lot in the Lagoon of Venice and looking at the city of Venice itself. This is sea level in the past, projections by the IPCC. This is actually the old, the 2013 report, but things have not really changed too much in terms of projections. We're still around 50 centimeters increase according to the 8.5, RCP 8.5, one scenario in the Northern Adriatic right here. So this is what awaits Venice and what we need to be prepared for. And in order to visualize that, I'm showing you, this is a painting by Canaletto. Canaletto is a famous Venetian painter from the 18th century who was using a camera obscura. It's a device that projects the view the painter wanted to paint on a board. And so Canaletto was actually preserving the proportions of reality very, very, very closely. And it has also been used to estimate sea level rise by others. But here, we'll use it just for illustrative purposes. If we take two people and we'll assume the adult here is 170 centimeters, the average height of a person in the 18th century, and we can now look at what happened in 1966, which is the largest flooding in Venice that I'm sure all Italians here know about. It's been what triggered really the process of building some protection for the city. And this is what happened in St. Mark's Square. At the time, on 4 November 1966, we had 110 centimeters. So that event was caused by a storm. If that storm had come about in 1750, when the painting was painted, this would have been the level that we would have had, all right, much lower. And projections tell us that this is what is going to happen by the end of the century, all right? So this gives you a sense of urgency of what is being done, and actually has been done, because the Mose, the protection of the city has been completed and is operational now with lots of problems, of course, bribery and stuff, but at least it's there, and it started protecting the city. So one question is, how tall does it have to be, right? So again, we are facing the same problem. We know the future is going to be different. How are we going to compute that? So the engineers in that case, you know, oftentimes you don't have information, you just add a meter. They added a meter to the largest historical event. So this is the maximum elevation, water elevation that can withstand. And today, if you do your analysis that I showed you before, that corresponds to 19,000 years return period. So yeah, it should be pretty safe. But what's going to happen at the end of the century? The end of the century, with sea level rise accounted for, it's down to 3,000 years. So, all right, this time the engineers really abandoned, you know, it's tall enough. So we should be happy. Of course, so it's very effective. So these are the floodings that it is preventing. By the end of the century, 170 days of flooding of the city if we do nothing. 0 if we have Mose, the red line. So controversial, but clearly effective. The thing is that really extremes are very important and are being held out, but, you're closing many times down the road, right? So we're closing maybe 7 days a year this time. Now it's going to become 20 days a year in 2050. 260 days a year by 2100. Clearly, that's interfering. It's a major interference with the ecosystem, with life in the city. So likely, we need to start thinking about something else, an alternative, because by 2050, 2060, this is going to close. This is going to be more closed than open. And this is unbearable. This is impossible. You need to find other solution. It took us 50 years to decide and to build it. So we barely have 50 years. We'd better start thinking about it. So this is another example. Change. Change is the issue. Change needs to be incorporated in what we do. Hurricane, another example. Atlantic Ocean hurricanes with colleagues in Milano, a colleague in Milano, then PhD student in Milan. We were looking at the record of hurricanes. This is the publicly available record, heard that 2 record with all the trajectories of all the recorded hurricanes and their intensities along the path. And so we applied some of these concepts to this data set. And what we come up with is that you look at the black line. This is the probability of a category 5, of at least one category 5 hurricane occurring in any given year. And it's been, of course, you see very clearly increasing year by year. Global warming, most likely, change again taking place. You have to allow for change in your models, in the way you're looking at the future. Now we're at about 45% probability of having at least one Category 5 hurricane in the Atlantic, and this is likely increasing as climate change progresses. And now, back to One Health, I guess, or health at least. This is the work that Professor Penn was mentioning earlier. These tools are being developed in other contexts, water science in particular, but are fairly general in nature and can now account for change. So this was a COVID-19 pet project that I had, and then I shared with colleagues. We decided to look at, can we say anything about how likely a pandemic is? I looked it up, Googled it, looked in the literature. Really, we don't have many good models of what is the likelihood of these events, which is strange, no? I mean, arguably, it has been affecting our society for a long, long time. And in fact, not finding any good data on it, I decided to, we were all in a lockdown, decided to go through through a large literature. One of the main sources is here, this encyclopedia, which is very nice. It describes every single epidemics that has occurred since the 15th century. And, with a lot of description, the ship arrived in the harbor, this particular sailor had cholera, and then it spread everywhere. So a lot of detail, and interestingly, it also had an estimate of the number of deaths. So not only now, after a lot of patients, we have a long record of occurrences. So these are the number of epidemics larger with more than 10,000 deaths that have occurred since 1600. And so not only we have the occurrences, but we also have the amounts for most of them. So I documented 476 infectious disease epidemics larger than 15,000 people, 15,000 deaths globally. And we use similar tools to those that we use to estimate the extremes that I showed you before. So don't look at the mathematics. I can be painfully detailed if you want after. But the bottom line here is that by pulling together all these events, suitably normalizing for the population of the time, because population has been changing since the 17th century, we found that surprisingly all these events, all these epidemics and pandemics fall on one single probability distribution of the intensity. So you see here the most intense and largest event ever recorded is the Spanish flu, which caused between 30 and 100 million deaths over a time of 2 years. And here you find a lot of plague in France and Italy is a famous plague in Venice also as well, which is recorded by several churches that have been erected at the end of it. So it is incredible that one single mathematical expression should capture very robustly all these events. And we can now use this information. And by putting together all these ingredients, we could estimate for example, the probability of a Spanish flu-like epidemic over time, going up and down over time, as it should, because the occurrence process is very variable. And finally, this is something that is of interest to all of us here. We estimated the probability of a COVID-19-like event in the future. So if everything stays the same, which we know it won't, right? Change is occurring all the time. The occurrence of epidemics has been changing dramatically between the 17th century and today. But let's assume things don't change. If things don't change, each one of us here, if we get to live 100 years, have a probability of 40% of encountering a similar event. Not a small chance. But things will probably not stay the same. There's some debate about whether emergence of new diseases is becoming more frequent, and Bill is the right person to ask. If some say there will be a steep increase due to environmental change and other factors. And that figure could go up to 76% or thereabout. So this is a major problem, and I was very, very happy to know that things are really getting to the root of it. We need, WHO and states need to get behind having some response which is much more serious than what we've seen, which was honestly really ridiculous, compared to the type of event we had to face. So I'll just leave the conclusions there. The main point is that we have to be ready for change. You will have to face change we all have, and we're older. You will have more than us to face change and to account for it in whatever you do. And thanks for listening.
Thank you very much. This talk is also very welcome. We're open, certainly, our mind. And I wonder if there's any probability that things go better than worse.
Well, we must be hopeful, I guess. But
no, we must do something.
Yes, we have to do that. We definitely have to do. And one question that I would have for Bill is clearly the WHO and the FAO, they're getting behind this idea. I wonder, how serious are the governments? Because in the end, you have to put the money into it. So I really hope we can be better prepared next time.
One question. We are very late, but then I think one question at least is deserved.
Sorry, I had too much coffee this morning, so I'm asking lots of questions. So sometimes we actually happen to have, let's say in the pod delta area, compound events. So at the same time, we have over the threshold sea levels, and we have over the threshold discharges. And we're actually seeing something like this in terms of global health nowadays. We're in the middle of the COVID pandemics. And we also have the monkeypox hitting now. So is there any kind of modeling that you have been performing that takes into account compound events and not only a single variable or a single over the threshold variable?
That's a very good question. I work a lot on coastal problems, and clearly coastal flooding is a compound event. As you mentioned, it's sea on one side and you have floods coming in from the other side. So that's a very real problem, and it's a difficult one, because if the two events were independent statistically, it would be easy. You just need to multiply probabilities and it's done. But in reality, that's not the case. So there's a lot of research on that is going on, looking at spatial extremes, compound extremes, as you mentioned, but it's still the edge of what we can do. So we have a few models, but there's a lot of work to be done for the future in this field.
Thank you again, Marco, and yeah. So I think we also saw some references. The talk, the slides will be available, but I think some of the references we saw are very important, and I invite everybody to look at these articles. And I will do it myself, of course, very, very appreciated. So we go further, and now I invite two colleagues. The first speaker is Alice Ferrari. So and then also Alessia Cariani. They are colleagues at the environmental science laboratory, let's say, and they didn't participate to Wacoma as a teachers because the teaching was shared with the other universities, but they have certainly a lot to say, and then also they will be involved in the next Wacoma, in the Wacoma opened by the University of Bologna. So welcome, and please, the stage is yours.
Thank you. Good morning, everyone. We are really glad to be here today, and for this I will greatly thank you, Professor Fabbri and the organizers. So today with my colleague Alessia Cariani, we will be presenting two international projects that are joining their efforts, Italy and Croatia, into the answering of the European request to mitigate the human impacts on the marine resources. In particular, the first Interreg project that I am presenting is PrizeFish, which was concluded in 2021, but its capitalization is still ongoing, and we will see how. And this Interreg focused on the eco-innovation of the Adriatic fisheries sector. So we are still talking about coastal management in terms of marine resources. Among the main aims of the project, we put a lot of effort and ideas into raising the sustainability of the whole supply chain of the fisheries sector, from the collection of the commercial species to the trading and distribution to the consumers. And on the other hand, we also try to raise the value of the local seafood products. We know that the Adriatic Sea is really rich, it's a shared resource, and it is our aim to boost the local use of these resources that most of the time are exported. So among the pillars of PrizeFish, we count 14 subjects, including universities, research centers, but also territorial institutions and ministries, like the Zadar County or the Emilia-Romagna region. We counted on the support of small and medium enterprises already working in the fishery and seafood production and transformation. We included a center for the marine habitat conservation, CESTA, and we had also the great occasion to involve the younger generations who are actually studying at the Remo Brindisi High School nearby in Comacchio to become the future fishermen and hoping fisherwomen also. So PrizeFish stems in really simple question, which is how much I, as a consumer, will I be willing to pay for a sustainable seafood product? These questions appears simple, but we experience that the answer to this question are really diverse and sometimes difficult to be integrated. Basically, with PrizeFish, we aimed at finding the best compromise between the price of a sustainable product and the price of the consumer who feels engaged into doing something for the environment. So with this Interreg project, we worked for the innovation of 3 main compounds: fishery. So we work for promoting innovative technologies, basically fishing gears, to be designed and tested and distributed to fishermen who contributed to be more environmentally and economically sustainable. So a second step was in the innovation of the transformation seafood processes. So we worked directly with the small and medium enterprises already working on the transformation of primary material and that adopted innovative technologies to provide healthy and safe food. On the other hand, we also have been working for the innovation of the marketing, because these local products have been tested by consumers, and we try to raise the competitiveness of these products, adding a value which is ecolabel. But as I was mentioning, this project stems into the principle of the sustainable development. So the pillars, as we all know, are social impact, economic impact, but also environment. And when we think about the environment, we could think about, I think, 100 variables. In prize fish, we focused on the integration of an ecological model based on food webs, so trophic levels, using a model that can integrate all this information on the marine ecosystem at all the levels, so from plankton to the apex predators, but including the fishing effort. So while modeling the Adriatic ecosystem, we also considered how many fish are working in that area, how many vessels are operating in a certain area, and which fishing gears have been used. So all these main actions, good practices for the responsible fishery, the innovation of the supply and process chain, and the innovation of the chain of value, had one main goal consisting in the promotion and trading of eco-certified products for the Adriatic Sea. And to do this, we developed a certification scheme that we call the Adriatic Responsible Fisheries Management, basing our knowledge and comparing the existing trades on the trademarks on the markets, and the most famous certification that you can see at the supermarket. And in our opinion, and now this certification is under evaluation, it's it nests really, is really fitting the principle of sustainable development, because it takes into account all the 3 pillars that I previously mentioned. But this is on paper, let's say. What prize fish did in practice, it's really, really interesting in my opinion. Working on the fishery itself was really interesting, and thanks to the collaboration of CESTA, we were able to conduct this pilot action on cuttlefish. Cuttlefish is a cephalopod, is a mollusk of great value here in Emilia-Romagna and in the Adriatic Sea, which has a really peculiar life cycle. Usually adults mate, females proceed with the egg deposition and die. So the life cycle is really seasonal and brief. The particularity of the fishery of cuttlefish is that we use traps. But these traps at the same time are used for fishery, but also from females who use them for egg deposition. And traditionally, and in recent past, fishermen used to wash away the eggs while fishing the adults. With the engagement of fishermen and the help of Cesta, we succeed into a new mental scheme where fishermen were bringing the eggs to Cesta to let them hatch ex situ, let's say, and then the juveniles have been released at sea. So continuing the turnover of this precious resource for the Adriatic Sea. In Croatia, we conducted a pilot action with a modified rampon used for the demersal fisheries, so which has as target flat fishes, but also big clams. And this modified rampon has the potential to be less impacting on the seafloor and also on the commercial species. Here in Italy, again, the fruitful collaboration of CNR and Cesta led to the modification of a traditional trap used here for mantis shrimp, which is also a really appreciated species in our kitchens. And the problem of traditional traps is that they collect the target species and bycatch species, so non-accessorized species, let's say, which usually have no commercial or low commercial values as crabs or gobies. So Cesta and CNR modified these traditional traps, letting escape the unwanted species, let's say, and engaging again the fishermen from Marina di Ravenna, who tested in the field with a really positive effect on the secondary species. In Croatia, our partner Omega-3 employed a sea pump system usually employed in aquaculture, tailoring it into the fishery of small pelagics. So in this way, this pump system takes the small pelagics from the net to the deck without effort, not that much effort for fishermen who usually used buckets and their arms. So in this case, also the quality of life of fishermen was highly granted. The same adult and effectively selected sardines have been employed for preparation of seafood, so treated with innovative methodologies to guarantee the health and safety of the seafood final product. And this is all certified. In Croatia, again, colleagues from Istra designed and tested with this pilot action machine which is able to effectively separate the muscle of red shrimps from the shell. And the final product mixed with the fish meal has been employed for preparing burgers, which is a valid alternative to meat burgers, and also treated with innovative approaches and employing skin packaging. Here in Italy, FC Bivolvia tested this selector for clams that is really effective into separating let's say, the high quality clams from the lower quality, and also preserving the quality of the resource itself. And these clams have been treated with a high hydrostatic pressure to reduce the bacterial load and the spores in order to guarantee safety and healthy food. And then, of course, they have been prepared for consumers as as it is, or with the adding of tomato sauce ready to cook. All these products have been proposed to consumers, and we try to understand the attitude of consumers towards these eco-certified products. And we evaluated their engagement in very different let's say, thematics and topics. So sustainability or convenience, or the fact that the origin of the fish is known and local, or simply because consumers are searching for something new to try at home. We also developed an e-commerce app that is similar to Google Maps, let's say. But in this case, the consumer can find in real time the freshest seafood product with the list of species, with the name of the fishermen who collected them, and of course the price per kilo. As I was saying, the involvement of young generation is still ongoing. Students are still studying and proceeding with their own career in this field. And this is a key point of the second project that we are going to present, Tech Era. It's also an interreg. So Croatia and Italy, again, shared ideas, expertise and skills to follow the blue transition. And with Tech Era, we are trying to find new solutions for the Adriatic Sea with the goal of sharing as much as possible the data that we already obtained with the previous project, and create a more effective marine circular economy. Tech Era has just begun, and will capitalize, as I was saying, the results of previous Interreg projects like Sushi Drop, Price Fish, of course, Adria Reef, Ithaca, Blue Cap, and Fair Sea. This because we want to enhance the sharing of our expertise and know-how, and demonstrate that the integration of all of this data can be very can be a really high benefit for the transition. The consortium of Tech Era is, let's say, less dense than in Price Fish, but we are really working closely and putting a lot of effort and synergies. The main, I love this picture because I think it well summarizes the principle of Tech Era. So nowadays, we always been living in a hydrosphere. So we are taking resources and services from it. But we are living also in an infosphere, and we have to make these spheres talk together. And that's why we are promoting the adoption of the available technologies of nowadays to interconnect all these results, all these big data, as we called it, and to transfer this knowledge to one, of course, the target area, but also beyond, hopefully. So as a first objective, Tech Era aims at creating clusters of sectors for data sharing and propose a sustainable spatial planning of the marine realm. And to do that, we would need to develop databases and repositories. But we won't start from scratch. We have Fair Sea, who was creating an integrated platform that counted oceanographic, bioeconomic, and ecosystemic data. Sushi Drop, which is using the WebGIS and a drone to map the seafloor. And Adria Reef, who is working on 3D models of the marine seafloor to reconstruct a virtual reality. The second objective of Tech Era is the capitalization of the technologies that we have been producing in Price Fish and Ithaca, in order to boost our competitivity on the European and international market and our sustainability. And as objective 3, as I already mentioned, we are promoting the blue careers. We need young researchers, young students approaching to those enterprises who are already working with sustainability and help the turnover of workers and create new opportunities. So we need you and your ideas and your passion to help us in introducing you to sustainable fishery, for instance. In this sense, Blue Cap already, the past year, already promoted transboundary exchanges and shared educational system that can be scaled at different levels. And also Fair Sea was working with the early childhood, promoting a table game, which is really funny. So let's step into the blue transition. It's time, and I thank you for your attention, and we are ready for questions. I was short. Not short, I was concise.
You were perfect. You calculate your time. Thank you also for this. And I would just say that, well, we touched another topic, so fisheries, and but as you see, I mean, I've heard this presentation about the project before, so I was really admired of the work they did. And that's why I invited here Alessia and Alice to speak. But so Alessia is a young professor, at least for the Italian standard, but she is very young. And then she was the leader of this project of prize fish. So you have seen there was a project with, I think, 18, I don't know, many partners, and of different I mean, of different fields, so academics as well as government bodies and fishermen and many others. So it was certainly a well, not easy task, but they did it nicely, and then they ended up with the concrete answers to the. And also they are starting, they're keep capitalizing on tequera. And I just one word on Alice. Alice, we have a collaborator, Alice. So again, a very young collaborator, just started this year, I think, the career of researcher at the university. So you see how good can do also youngs in our system, and they actually bring new ideas, and so this is
an invitation, official invitation also for all of you.
Yes. If there are questions, a comment?
I was really impressed at the point that the first speaker highlighted. So we shared one health, one world, one sea, but we also need to share the words. So it was one of the main challenges of this project, which is not a research project. Interreg are not funded to do new research, are funded to improve territories. But the most challenging task was to speak the same language. So we were academic, but fishermen. We were really sitting at the same desk, virtual because of pandemic, but we tried to meet as much as possible in person with the territorial manager, politician, and marketing expert, commercial. So it was the main challenge. Once we define what was
the main language,
the shared idea, then it will all work, let's say, more smoothly, and because we were all engaged to the same goal.
Thank you.
Yeah, thank you. This is a take-home message that is of great importance, so remember it. I think we can move further. Maybe if you have questions, we have a little bit of time afterwards. And so I invite now an alumna. We introduced her a little bit yesterday, but then here is our alumna, first year of Wacoma, Iphigenia. I don't even pronounce your surname, you pronounce yourself. And it's a pleasure to have you here,
Thank you very
pleasure
much.
that you are here as an alumna, but also representing a successful story working in a company in Spain. Thank you, Iphigenia, please.
Thank you very much. Hello, everyone. I'm Iphigenia, and the topic of the present talk will be related to offshore wind farms in Spain and a little bit about the framework, but I will mostly try to walk you through the back office, let's say, and in order for you to understand what also can be the possibilities after Wacoma. How does it go? Okay. We will start with a brief description, let's say, of my background. Then I will refer a little bit about the maritime spatial planning of Spain, just a very, very brief description. And what are the deliverables that are requested, let's say, from the administrative bodies in order to start the assessment of the offshore wind farms. And at the end, I will make a short presentation about Parc Tramuntana, which was the first project that I got involved in, mainly one of the reasons that I'm here now. So there was a mention yesterday, just to make it clear, I'm the mother of Frappe, the Wacoma dog. I was born in the United States, and after some years, we moved to Greece, where I did my bachelor's in oceanography. Then I moved to Portugal, and where I did my Erasmus stage, and also my bachelor thesis, and I graduated from there and also from the University of the Aegean in Greece. Right before my graduation, I moved to the United States in order to work at the State University of New York and the Maritime College as a boat handling instructor and a seamanship instructor. It was a nice experience. And then right after it was just a summer season job, and I came back to Greece where I started my first master's until Wacoma came. So why Wacoma? I'm mostly interested in the management side of our science, let's say, and that's why I chose Wacoma. And this really verified my choice when one of our professors in the first semester, Paolo Ricci, I don't know if you had him, someone asked him, what is a manager? What does a manager needs to know? And he said us, well, a manager doesn't really need to have an expertise. A manager needs to have a decent knowledge in like all the fields of water and coastal management, or like whatever field it's in interest, let's say. So after the first year, I really wanted to stay in Barcelona, so I managed to do my master thesis at the Spanish Research Center at the Institute of Marine Sciences. And meanwhile, I did my internship at Tecnoambiente. And the thing is that at this moment, when I graduated, there was not really a necessity, let's say, for consultants until October of 2020, when I received a call from my manager, and he asked me, could you work for us for just a month? Because we have a necessity, like an urgent project. And here I am, 2 years later, as their geospatial analyst. Moving on to the topic of my talk, I will refer to just a brief description, I promise, on maritime spatial planning of Spain and how, what is a little bit the administrative process in order to deliver, let's say, the desired documents. As you know, there is this EU directive which established a framework for maritime spatial planning. And within this MSP lays the maritime spatial planning of Spain, which has the ultimate objective to maintain the good environmental status of the marine waters. This MSP has been divided into the 5 marine subdivisions of Spain, which consists of the North Atlantic, the Levantine Balearic, the Strait and the Alboran Marine Division, the South Atlantic, and the Canary Island subdivision. And so within these subdivisions, the administrative body has designated several areas that you can see here as the red polygons, you can see, yes. And so all the interest stakeholders, let's say that they are interested in developing offshore wind farms, they have to, let's say, develop them inside these designated zones from the ministry, let's say. But what are the deliverables? What's behind all this? And here we come to the back office, let's say. Some of the documents that they need to be delivered is the desktop study, which consists of public data, which I will talk briefly later on how you can obtain them. Once this desktop study is being delivered and accepted, let's say, we go on with environmental impact assessment, which is a very extensive study, as you already know, and consists both public data and field data. And in the case of Tecnoambiente, we produce them in-house, and they consist of hydrographic surveys, geophysical surveys, geotechnical surveys, and environmental surveys, among others. However, I'm not yet involved in this data acquisition, let's say. So I will mostly focus on the publicly available data. So what are the variables that we are studying? We divide them, let's say, within the physical environment, the biological environment, and the socioeconomical environment, both for the marine and the terrestrial environment. Because, as you will see later, the offshore wind farms, they need to be connected to the main electrical substation on land, so there will be an affection also on land. Within the physical environment, we are studying the bathymetry, the slope, the marine geomorphology, geology, and hydrology. Within the biological environment, we look for the benthic habitats, pelagic habitats, terrestrial habitats, vegetation, and fauna. And the socioeconomical environment consists of the protected areas like the Natura 2000, fishing activities, aquaculture, maritime traffic, urbanism, landscape, land uses, cultural heritage, road and electricity network, among others. But where can we find this data? All of them, depending on the area, they can be found from the public providers, let's say. In the case of the bathymetry, I guess most of you know the website of the provider of EMODNet, which is from the European Commission, let's say. And you can find bathymetric data for whole Europe, and not only. For the habitats, we mostly look on a more national level. So the data are being obtained usually from the ministry, which here you can see that this is like a viewer, an online viewer that you can have access. It's very easy. And then for the marine traffic, for example, which is inside the socio-economical environment, the data are found from the marine traffic website and the fishing grounds from the Spanish Institute of Oceanography. Fishing is a variable, let's say, that has always been problematic when we're talking about offshore wind farms, because it's an economic sector that would be directly affected. And also for the protected areas, for example, in the case of Catalonia, we find the geospatial data from the Generalitat de Catalunya, and for the same region, we have more than 9 different resources for the different variables that we need. Each region in Spain has its own resources, but you can also find You can also find like the data from also the ministry that consists of whole Spain and the Canary Islands and the Balearic Islands. And now we move on Parc Tramuntana, that, as I said, it's one of the reasons that I'm here today. Sorry. It's an offshore wind farm, a floating one, which will probably be developed in Catalonia, with offshore of the province of Girona, and would consist of 36 wind turbines, would be 24 kilometers, would be placed 24 kilometers offshore of the province of Girona, where this arrow is. Each wind tower, let's say, would almost have the height of an Eiffel Tower. I mean, Eiffel Tower has like 300 meters, I think, while the wind turbines and all the structure would be 256, more or less, and would have a capacity of 500 megawatts. And it is studied that would cover 45% of the current electricity demand in the province of Girona. You remember in the beginning of the presentation that I referred to these designated areas that the ministry has established, let's say. Parc Tramuntana will be placed in one of them, of course. As you can see here, this white polygon is one of these areas, while the blue polygon here is the occupation area from the offshore wind farm. Would have an occupation of approximately 95 square kilometers, if I'm not mistaken. And these little dots here you can see are the wind turbines with their interconnection cables. While yesterday there was a question on this, I remember. So these interconnection cables, they transport, let's say, the energy with export cables that they afterwards would connect to a terrestrial, let's say, substation, that this substation would elevate the desired electricity in order to finally connect to the, here you will see, here, would finally connect to the central electrical substation, which in our case is Red Eléctrica. It's like the main energy provider in Spain. So with all this data that I showed you before and all these providers that you can find them and everything are being coupled in ArcGIS eventually. And here you can see the natural protected areas, especially here is the Natura 2000. That's one of the, let's say, one of the types of Natura 2000 you can find related to birds. Here also to some other habitats here as well. And as you can see, Parc Tramuntana will be placed just right outside. And just to answer a potential question, will this happen? We do not really know. But what we do really know is that it's maybe the only one, or maybe the second one, that has started field campaigns, and we are continuously collecting field data. So that's what I'm doing. Well, that's what I'm actually doing. Thank you very much.
Much, Virginia, and I think she brought us a nice experience, and maybe, well, you stay with her in these days, so maybe all questions have already been done. But if there is any question, it's welcome.
Or after.
So thank you. I was wondering, the last project you presented, is it encountering a lot of environmental advocacy opposition?
Yes.
Because near here, as you may know,
Yeah.
there's similar projects that.
Yeah, so that's a very good question, but as Professor Elliott mentioned yesterday, and Luis as well, I'm still an apple in this industry. So I do not arrive to these negotiations, but I know from my managers that they continuously have debates with fishermen, with Greenpeace, with all the affected stakeholders, let's say. And they recently published a paper where they mainly talk about all these polemics and what are the initial affection that we have found. Because of course it's a project of 2 years, it's a very initial stage, let's say. But yeah, it's, we mainly find issues, let's say, with the fishermen and also with the touristic industry. Because even though it will be placed 24 kilometers, some modeling that we have done on visibility, it has shown that, I repeat, it's at an initial phase, it has shown that they will be shown. And this zone of Catalonia is a very touristic place with lots of mountains, lots of nice beaches, and so the touristic sector, for example, has been really opposing.
Thanks, Virginia. To continue a conversation we started having yesterday. I think you have to keep getting the message to the local people, as Marco said, about the costs and benefits.
Right.
Every method we've got of generating electricity has an effect. But people want something to happen. When they flick the switch on the wall, they want something to happen. What we're now thinking more and more about, and as we're talking, I mean, offshore wind farms, especially in the North Sea, are becoming huge now. 1,000 turbines is the biggest one. And so now what we're looking for is, these are going to happen because people don't always want them on land. And you have to start asking, we started talking about this yesterday, about the behavior of people. A while ago, Greenpeace asked people, where have you seen a wind farm? And everybody knew. And then they asked them, where is the nearest pylon, electricity pylon, the tower for that? Where is the nearest one to your home? And nobody knew, because they've all been absorbed into the landscape. So what we're thinking more about now is co-location, joint activities, aquaculture inside of wind farms. As you saw from the scheme yesterday, wind farms with solar power, wind farms as protected areas, and as no fishing zones, but where they spill over. So we have to get over the message that there are joint wins in this, and that, yes, there may be birds and bats that get killed, but actually the number of birds that get killed are no more than if you put up a new glass building. So we have to keep getting over these messages that, okay, you don't want wind farms. Do you want nuclear power? Do you want coal power?
Exactly.
Do you want gas? Whatever it is. So keep making the messages. And I don't think you are an apple. I think you're moving more into the sort of the applesauce or even the apple crumble.
Thank you. Yeah, right. This is always, every time that I'm discussing with someone, that someone is asking me, what are you working on? And I'm saying offshore wind farms mainly. There is always like an opposition, like, oh, you as well, And I was like, yeah, I am with the good ones. We're trying to make this happen, but also with a minimal environmental impact, let's say. But integration is the answer. And every new thing that comes out, there is always a combat behind. So I think with some patience and good management, we will get over it, hopefully. Thank you very much.
Thank you. And I have a last question. Where is now our beloved Frappe? Frappe is her dog, and he made all the mobility coming to Ravenna and then to other places. Where is he now?
He's in Barcelona with my flatmates, with my best friend actually right now. Thank you very much if you're watching me. Probably watching us as well.
Thank you very much.
Thank you very much.
Thank you. So we are now at our last speech for today and for the symposium. I had the pleasure to invite Caterina Righini. She works in the family company here, very famous and historical, I would say, company in Ravenna. And I've heard her speaking in a former meeting, and I was really impressed because of the history that short, because she's also very young, but the improvement and the experience she made abroad, working outside her family company and then coming back and bringing her expertise in the company here in Ravenna. So that's why I invited her here to speak about her experience and her company also. And thank you, Caterina, for accepting my invitation. And I invite you to present at the microphone. Thank you very much.
Very much. Good morning, everybody, and thanks again for the invitation. I know I'm the last speaker that stands between your lunch, so I'll be quick. And my presentation will be way less technical than the ones that I had the pleasure to hear. Hello. Okay, thank you. Do you hear me well? Okay. My name is Caterina Righini. I was born here. I was born and raised in Ravenna since the age of 17. And then, as Professor just mentioned, I moved abroad. I tried to get as much experience as possible abroad in order to understand different cultures, understand different ways of working, ways of living, and also try to find ways that I could bring back home and I could harmonize between my life and also my family business. So I moved to the United States. I went to Texas for a year where I was a high school exchange student. And then I came back to Italy and I studied economics. So I have a bachelor in economics and a master in finance. And during my bachelor and my master, I tried to travel as much as possible. I have a deep passion for traveling, so I tried to combine doing internships and doing travel. So I lived in Southeast Asia, big passion for Southeast Asia. So I lived in Singapore and in Malaysia, and then I moved across Europe. So I lived in Switzerland, and I lived in Amsterdam for 2 years. And prior to joining the family business, I wanted to get as much exposure from international companies, big multinational companies. We are a small medium enterprise, and I will deep dive into what we do and the size of company we are. But I worked for Shell, so if people looked at you asking, you work for offshore wind, imagine working for oil and gas these days, they look at you like you are the devil. So I can assure you that, especially when I was in the Netherlands, where people are very climate conscious, and I said I work for Shell, and then you can imagine the looks I was given until the point where we had to take off the pectin, which is the Shell logo, out of our backpacks, because people were basically throwing tomatoes at us in the morning. So, so offshore wind now feels a very, very calm environment compared. And then at the end of 2019, just before the pandemic started, I moved back home. I decided to move back to Ravenna to work for my family business, to try to get as much experience from what I learned and try to find new ways of looking at new and old problems. I will... and I will tell you a little bit about our company. So the company was founded in 1951 by my grandfather and his brother, and hence the name, the FLLI in Italian is brothers, shortened. So it's like bros in the American companies. And we are still family-owned company after 70 years. So last year we celebrated, or well, we couldn't celebrate because of COVID, but 70 years of activity. And we are an engineering and fabrication company. We started in the 80s working for the oil and gas industry, thanks to Saipem and Eni, mostly for the Italian market. And then we developed international clients. So actually nowadays 95% of our clients are based abroad, and 95% of our projects are done internationally. So our equipment is basically installed everywhere from Brazil to Korea to Asia and Northern Europe. So we have And here you can see this nice picture. This one actually is the last group picture we took before COVID. It's a picture with 4,000 tons internal lifting tools. These are used for decommissioning of old oil and gas platforms that reach end of life. And this is one of the projects. And the reason why I chose this picture is because, first of all, I think it shows the magnitude of the kind of equipment that we produce. And everything is designed and produced here in Ravenna. So we are quite close to the beach, to Marina di Ravenna. But this is also a way to show that we have the capabilities and we focus as much as possible on innovation and in trying to leverage the know-how that we developed in 70 years into a new industry. Because just to give you an idea, if I look at the balance sheets and the accounts that we deposited in 2018, 0% of revenues and 0% of margins came from offshore wind. Everything was oil and gas. We approved 2 weeks ago the 2021 books, and 75% was wind. So you can imagine if we didn't adapt, we probably would have died by now, or we would be really struggling to find ways of financing the company. So I want to be very clear. This has to do with sustainability, I think, in a very broad sense, because I think sustainability means, of course, having a very close look at the environment, but it also needs to be sustainability in a broader sense. As an entrepreneur, I look at sustainability also in terms of people, in terms of skills, in terms of companies that rely on our company. So we have a network of about 2,000 sub-suppliers in Italy and abroad, and I think sustainability also goes through these channels as well. So meaning if we manage to adapt from oil and gas and we manage to find our skills and move them into offshore wind, of course the wider network benefits. Our employees, of course, we keep hiring people, so that of course is something that's beneficial to the city, beneficial to the people that work for us, but then also to the network of sub-suppliers. And I think we have a cascade effect towards every stakeholder that's involved and that has an interest within the company. So what we try to do is, and I'll show you here, okay. So what we try to do, as I said, we are an engineering company, so the biggest asset that we have is brain power and is know-how. And we sat to the table, and we were called by one of our clients who said, why don't you look into offshore wind? And we said, no, we're too busy. We don't have time, sorry. We have all these tenders for oil and gas, and we really have zero engineering capacity. And then we said, okay, let's just dedicate one engineer, very young engineer actually, to look at offshore wind. Maybe it's the next big thing. And then he started working together with our client, and he started developing an internal lifting tool that previously was used for jackets pre-piling, so for the foundations of the jackets for oil and gas platforms, in order to install the monopiles. And basically monopiles, I'm not sure if everyone is familiar, but the monopiles are the large piles that stand below the turbine. So the turbines can be installed with very different foundations. So you can have jacket foundations, but you can also have monopiles. And our internal lifting tools are used for installing monopiles. And we basically understood that the difference was not that huge. We had, of course, to leverage on know-how. We had to find new skills and we have to find new competencies. And thanks to our clients as well, we grew. But at the end of the day, if we really looked into what have we developed in the last 70 years, the differences were not huge. And with some effort, of course, and with some investments, we managed to find ways of bridging the old sector that basically was what we lived off for 40 years, which is oil and gas, into offshore wind, which nowadays is the main sector in which we operate. So this comes back for me to flexibility, into understanding that time we got a question, not to say, I'm sorry, we are fully booked. Our proposal department is booked. Our proposal department is completely taken by oil and gas projects. We don't have time to look at this. Instead, we said, okay, let's just get one person looking into this and maybe trying to understand if really we can change without revolutionizing the company. Because as you can imagine, we are a family-owned company. We have about 100 people working for us. We cannot just say from one day to the other, okay, we switch. Because the European Commission has said that funds are moving into another direction. Let's just switch everyone. And if you don't adapt or if you don't change, that's the door. Of course, that's not how a company can work, or that's not how we want to work ethically as well. So we said, okay, let's try to find ways. And of course, you need a vision. You need to understand that's not something that can happen from one day to the other. But you need to have a vision to understand, okay, we have these competencies. How can we become the trusted partner that we have been for the oil and gas and for our clients, for new clients as well, and for different businesses as well. And this is just a slide to show you some of the things that we leveraged mostly on. So and as you can imagine, change is difficult. And I've seen it, I've read it in books. I read a lot of books about change, and I always thought, I know quite a lot about change. You know, moving, I moved 14 houses in 10 years, and I said, I think I can do it in the company. I think it's easy. The hardest thing to do is changing people's mind. And I see it even today, and no books, I think, could ever give me the culture to actually do it and implementing it, because everyone is completely different. And the ways that people change their mind is completely different, and actually what makes them, you know, changing their mind and the tricks that you can in a way put in use are completely different for everyone. And as you can imagine, from the offshore oil and gas, here I show the two pictures that you see on the top left corner. So the two, let's say, red equipment. These are J-lay friction clamps. These are friction clamps that are used in pipe laying vessels for laying for laying oil and gas fields. And actually we have a world leadership on these J-lay friction clamps. So all vessels, or mostly all vessels, pipe laying vessels, are equipped with our own J-lay friction clamps. We have more than 200 patents on these J-lay friction clamps, and our technical director is, even according to our clients, the most knowledgeable person on this planet on J-lay friction clamps. So you can imagine changing that is not easy. You know, knowing that you have a world leadership and moving into offshore wind, an industry where people look at you and say, I'm sorry, who is Regini again? Like, do you do these things? Oh, you used to work for oil and gas. I'm sure you don't know a clue about about offshore wind. So you can imagine that change is difficult, and innovating is a very nice word, but it's actually very, very difficult to do in practice. So what you have to do is you have to bring people who are extremely knowledgeable on the table and say, this is a new sector, we have to invest, we have to go this way, otherwise everyone else is not going to work for the next 5 years or in the next 5 years, and try to make them accountable and try to make them a big part of what you're doing into moving to the next big thing, which in our case is offshore wind. So our technical director was engaged with our clients. We had a lot of meetings, and actually nowadays we provide almost a full range of equipment for offshore oil and gas, and we cover almost all clients on offshore wind, which didn't even know our name 3 years ago. So I think this goes back to how do we adapt and how do we make change possible for a small medium company, for a company that we cannot just afford to have 40 people on research and development of a baby project or a pet project that just doesn't go ahead. It's just not sustainable for us. We need to, at the end of the day and at the end of the year, when our accountants call us and we need to close the balance sheets, the final line and the bottom line needs to be positive, because otherwise the following year is going to be hard to hire people. It's going to be difficult to make investments. So we need to be very pragmatic. But I think if we look to the last 3 years, so it's not something you can look from one day to the other, but if we look at the last 3 years, we used to go into conferences, and again, like, people didn't even know our name or were not even interested in listening. And nowadays we are being asked, or we are being followed by our clients or new clients to say, oh, I have heard you have provided these types of tools for a wind farm. So I think it takes time, change takes time, innovation takes time. It's not something that happens overnight, but I think it's something, once you learn what are your core skills, and I think this applies also to a personal and professional life. Like, once you know what's your core, what are your skills, what do you like, what are you good at, and then you think, and then just don't sit on that thinking, those are my skills, those are my strengths, but just to think also, like, what's the future looking like, and can I think of new trends, new things, new sectors in which I could work, and then try to leverage on the knowledge you have, but also on how to bridge competencies that you might be lacking today. So actually, we come after the studies that Tecnoambiente and these companies do. So we are not so involved onto the bureaucratic side, which is actually nice not to be involved on the bureaucratic side of developing a wind farm. So we come once the wind farm has been approved, then clients ask us to provide the installation equipment. So that makes our job easier in a way, but I think getting there wasn't easy, and it's not going to be easy because, of course, offshore wind is going to be one part of the mix, of the energy mix, it's not going to cover the full range. And then we also, so for example, today we have two engineers looking at floating wind. Because if 3 years ago we moved into offshore fixed bottom wind, then today we need to think about floating wind. But we also need to think, what's about hydrogen and what about other technologies? How can we predict them and how can we invest some resources today in order in 5 years not to think, I wish I thought about that 5 years ago, because the world is changing at an extremely fast pace, and I think we need to be very reactive and very fast into thinking, how can we adapt before it's too late and before the changes actually happen, because then we wouldn't have time. So, again, I'll keep it short, but this is just to say we are a small and medium company. If you're interested, I'll leave you my contacts if you want to know more about what we do, and what are the challenges that we face. Then we can also deep dive into a project. I think at this time there wasn't enough time to do that. So yeah, indeed, the bottom line is really change is not easy. It takes time, but it's necessary. We cannot live without change, and we need to think about change before the change happens.
Yes, I was admired by these young ladies and I confirm. I thank you very much. I'm so happy you have been able to come. And you passed this message, very important. I don't know if there are questions. Yes, please.
Thanks, that was really interesting.
Thank you.
The problem I think that you have that's very unique is basically adopting and when to adopt new technology to modify your business model. And we deal with a lot of this in research in the gold mining area that I'm involved in trying to adopt and get people to adopt new technologies, especially companies that are doing gold mining, because there's not really an incentive for them to adopt new technologies unless there's a policy that's requiring them to make that change. And I think in the wind turbine area, maybe you benefited a little bit because the wind turbines in general as a business has already existed. But I'm wondering, the last thing that you were saying was how to anticipate what new technologies to invest in. And I'm wondering how that process works from a business perspective, since sometimes you get government support to do that and sometimes you don't. And so how do you go through that decision-making process of what to invest in next? That might be a broad question, but I'm just curious from you.
It's quite $1 million question, I think, but I'll try to answer that. Actually, just to be clear, all the projects that we have done for wind, we got €0 financing. And that's why I keep on saying, as companies, we need to be sustainable, which means at the end of the day, we need to make money. And it's no secret, because with no money made in a company, there's no way to invest. Because indeed, and of course, the $1 million question is still open, because if I look into the next 5 years is how do I choose what do I invest in? And I think the key question, the key or what we try to think is the key is try to think very broad. So we attend a lot of conferences, we speak a lot to our clients, because at the end of the day, our clients our clients are quite broad. So we have oil and gas companies like Shell, like BP, but our main clients are installation companies like Saipem, like Hirema, like Jan de Nul. And these companies, of course, they have a big knowledge and they think a lot about, what's next and what's going to be next and how can I adapt, for example, my heavy lift vessels to the new industry. So we try to find a lot of different sources. We try to get students from university. We try to get researchers from university. And I think as an entrepreneur, the difficult thing is time frame. Because if I go to a conference and I find that there's this new technology and that's very nice, and in 2040 for an entrepreneur is quite far away. So I need to think, and I think that the thing with being an entrepreneur is you need to think today, tomorrow, and you also need to think 5 years and 10 years. So how do you strike the balance between finding something that works for all time frames? So I think in the short term, offshore wind is definitely the key, floating and fixed. And I think in the future, the way we invest is, first of all, we go by baby steps. because we don't have the strength to say we invest 2 million euros on this new technology. So we try to find PhD students, for example, to work for us, or we go to conferences indeed, or we go to exhibitions, and we try to stay as open as possible into understanding what are ways in which we could adapt our skills or develop new skills. But basically, we try to get inputs from the market as much as possible. And then, of course, if we look into the same sector, but then as an entrepreneur, you also have something else that's on your brain, which is diversification. Like, do you actually want to keep all your eggs in one basket? So everything needs to be energy, the energy sector, or you want to try to find other sectors that might have a smaller appeal, and it might be a smaller piece of the pie, but can give you a very different business continuity compared to the energy sector. So I think you need to think very different time horizons, but what we try to do is, as much as possible, stay open, stay curious about what's happening on the market. There's so much data nowadays available on anything that's actually too much data, I think, sometimes, and especially for us, a company, as I said, about 100 people, we cannot afford having 30, 40 people sitting on data and analyzing data. So what we do is we try to get some of our young engineers, because I completely agree that young minds, a lot of the times, they think differently. They completely think out of the box. They think sometimes more efficiently. And we try to make them go to conferences or speak to our clients and brainstorm ideas. And then once a new opportunity comes in, we try with private equity, they would call it seed financing. Of course, in our case, it's our own seed financing, but we try to put, and start small projects and see if they can develop into new realities. And sometimes they do, sometimes they don't. Of course, with R&D, you never know the outcome. Otherwise, it wouldn't be called R&D. But we try to stay open. I think that's the main answer.
Thanks, Catherine. If I could just take this a bit further, you talked about the challenges that we've got at the moment, and that one of the biggest challenges, and you mentioned it, is decommissioning of the oil and gas infrastructure. Yeah. And now, given that offshore wind's been around, 30 years, we're also looking at decommissioning of that as well.
Yes.
And as you said, there are a lot of similarities. But you almost get the impression that for the engineering side, you can work I'm sure you didn't mean to, but in a vacuum, that you came after all the permits have been given, then you come with this as how to do it. But the engineering companies I work with are finding they're needing more and more to have the environmental expertise and the governance expertise within the company, or at least very close to it, because they're getting challenges on how to do something. Everything you do, every time you use your equipment, you've got to show that it is environmentally sustainable and everything else. So the big debates at the moment, so for offshore oil and gas, the big debates are, do you leave it in place after you finish with it? Do you topple it? Do you create a reef? Do you remove it? That then takes us into the whole debate about, well, what is the carbon footprint of that? And using your equipment has a carbon footprint, even the boats getting there and back. So companies are having to say, we want to do the engineering, but actually we also need to look at these other aspects, like the governance. What does the law allow us to do? Which directive are we needing to follow? What about the ecological side, the environmental side, the economics of it? So I think, as you said, it's getting all of those together. And companies can't work in a vacuum anymore. They have to have all those. But as I say, certainly decommissioning is now, well, certainly in Northwest Europe is the big thing. I mean, we're talking about the value of decommissioning in the North Sea being 70 billion, whichever unit of currency you want at the moment, because they're all getting very similar. But it's then Gulf of Mexico is similar. So these are some of the major challenges that companies are facing. But working together with environmentalists and economists, and that we are overcoming these as well.
No, I completely agree. I think there's not one way without the other. because it's especially with decommissioning. So we have done a lot of projects on North Sea decommissioning, because indeed it depends on, for example, in Italy, so far there's not really a decommissioning directive, but it is a huge potential for the market, and even for us, indeed, when we've developed friction clamps. Just to give you an idea, so these friction clamps they're all hydraulically operated, so they all work on oil. Biodegradable oil, but oil. And in the first ones that we did, my father said, I never heard the word, what is it sustainable? Is it green? Like, can it work better? Can it use less oil, or can it use a more biodegradable oil? That's not something that we, no questions were asked about that. Now we are studying a motion compensated gripper frame to install monopiles on floating vessels. And the question from our client is, no oil. It doesn't have to run, it cannot run on oil. It needs to be a fully electric solution. So it's a completely different way, and we could argue if it's better one or the other, because I think a lot of times even our clients, they do a lot of greenwashing, but nowadays the questions that are being asked are completely different indeed. So we need to work with the regulators, we need to work with the environmentalists. We cannot just stay, within our own company and think that we can change the world from there. Otherwise, it would be just a push approach, which doesn't work in the long term, I think. Thanks.
Very last question. Thank you.
Yeah, I just wanted to ask, the first person that you hired to do the wind energy, he was a science engineer, what was his degree?
So the person who was dedicated to the wind was actually someone who was already in the company. So we didn't hire him specifically, but he was a mechanical engineer with actually 2 degrees, so mechanical and aviation engineer. So quite a big brain, as you can imagine. He was a FEM structural analyst who had a passion for wind on his private time. He was a sailor, and he said, I know wind. Of course, it's a completely different thing, but some skills were very helpful. Some of his skills were very helpful.
Yes, thank you. Thank you,
very much.
Caterina, and congratulations for everything, your pathway and the contribution you are giving now to your company. So thank you very much.
Thank you.
Yeah. So actually, we wouldn't like to finish because this represents really the conclusion of our program. And then, but anyway, we are here. It's time to conclude. I thank all the persons who were connected through the web, through the computer, their contribution. I know that they weren't many. They weren't able to allowed to speak. But anyway, they sent messages, or we heard about them during the days. So and then I thank you very much. If you are still listening, and I thank the audience here to been with us in these days. I think they have been extremely interesting days. We learn a lot from different point of view, and so I'm very happy, and I thank you for being here, but mainly our speakers for the contribution they gave. And then, as a program, it has been an honor and a pleasure to guide this program for the years, during these years. It's been mainly a great thing to know all of you, to meet all of you students, now graduates, but also I keep saying students of the last cohort and then the previous ones, the ones who are here, and we are trying to follow your career. So if when it's possible, when you have the pleasure, just send information. So we are really happy when we see, and then we change phone calls or messages. Have you seen? Did you know? So it's a real pleasure. And I think that for some of you, we really change your life. I mean, not we, Wacoma, change your life. Change your life because maybe of different situations, not possibility to study, no time to study, or any situation, but also change your life because we think we open your mind through different object and changes, as Caterina is saying. So this is my main, what it remain. It will remain to me to have known somebody who really was happy for the new vision of her new job, her future because of Wacoma. So this is a main thing to me. And I'm sure that the coordinators, they are not here. You have seen that we have had several health problems during these weeks. Irene has to stay in the hotel. Alice Newton went away soon after her talk yesterday because she was not feeling well. So we haven't been so interactive as we usually do, but I hope you understand. But then I don't know if Irene is connected. Can you hear me, Irene?
Can you hear me?
Oh, yes.
Can you see me?
Yes. No, not yet.
No?
But yes, now, yes, you see you. I would like you say some words. Irene has been a fantastic coordinator of the University of Cadiz. She was always problem solving if we had any. And he was always very precise in her work, in her approach, and very, it was really like not only helpful to have help, but helpful to have support, to have ideas, to have solutions. Okay, so thank you, Irene, and then the microphone is yours.
Okay, thank you, Elena. It's actually my job to solve problems, although I normally do it with MATLAB, which is easier, but human interaction is also part of what we do, no? So, as Elena has been saying, it has been a very intense week, full of science, but also full of emotions, and we are all happy, but we are tired. So I will be very brief. And I promise not to cry, like the other day. I just want to say thank you to Elena and Stefano for making these events possible. Has been an amazing week, even though I haven't been able to join you in person, but I've been following every talk online, and I have learned a lot. It has been really, really nice. So I would also like to say thank you to the speakers, because it has been very, very interesting mixture of multidisciplinary works on different fields. So thank you for being here. And I also want to say thank you to all the Univo colleagues and the Wacoma associated partners for being here with us, showing their involvement with the program, with the students, and because this really means a lot to us as coordinators. Of course, has been a real pleasure to be here, even if I'm locked in the hotel. But even if we cannot create an Erasmus Mundus with the same consortium in the future, I'm sure that we will continue collaborating together with Univo, because I think this past experience has been fantastic. So we must continue working together in the future. Even though she's not here, because as Elena said, she wasn't feeling well and she's already gone. This morning, Alice told me that she tested negative for COVID, so let's hope it's just a bad cough. So, but I also want to say thank you to her for everything, and I will surely remind her that we have a lot of work ahead for the new Erasmus Mundus proposal. Of course, I want to say thank you to the alumni. I cannot see the public, so I don't know how many of you are still alive and there, but thank you for being here. And I'm sure all these talks that you have heard have been an inspiration to many of you and an example of the diversity of careers that you can access with Wacoma. So I hope you follow the path of our previous alumni and become successful in the future as well. And last but not least, I would like to say, to speak to the new graduates, to wish them good luck for the future, to be patient, especially with the University of Cadiz, because it will take some time until you get your diploma, but you will get it. Also, if you need the official transcript of records relatively soon, you will get it relatively soon, within the maybe end of July, September. If you need it urgently, please send me an email, and I will try to get it as soon as possible. But now I can see you. Some of you already know, but being alumni from the University of Cadiz, you can apply for the Erasmus Plus student mobility for placement or trainship. You have to apply while you're still students, and in theory you are enrolled until the 30th of September, or unless you need to close your studentship before because you need the graduation certificate earlier. In that case, your studentship will finish, but otherwise you will be enrolled until the 30th of September. The deadline for the open call, the call for this to apply for this mobility will open on the 1st of September. So unless you are in a hurry to close your studentship, you will be able to apply. You will still be on time to apply for this. And if you don't know what it is, these are scholarships. They don't pay a lot because they're Erasmus Plus mobility, but it's to carry out a trainship in any organization within the Erasmus Plus program, with the exception of European Union institutions, bodies and agencies. But you can find any research center, any company where you would like to do some trainship for a few months. And if you don't really know what to do at the moment, maybe it's a good time. You are also entitled to change your visa as looking for a job type of visa. In this case, you need to contact Carmen Lopez as soon as possible because the University of Cadiz will close in August. So please send her an email and she will let you know what you have to do in case you need to extend to change the visa if you are planning to look for a job in Europe. And finally, my intention is to pass by the Congress Center now so I can say goodbye to you on the street. Obviously, I still tested positive this morning. So unless you are in a hurry, I will pass by the center and I will say goodbye to all of you from the distance. So thank you for listening. Good luck in your future, and please stay in touch. See you in a while.
Yeah, thank you, Irene. Thank you very much. So, thank you. So just a few words to conclude, and then all these informations are the ones relative to the University of Bologna. You just ask Stefano. So I make it short. And yeah, there are possibilities, certifications, whatever. Stefano will give you all the informations. And just the very last word to thank the University of Bologna for the support given to the program when there was some problem to solve, and in particular to the administrative staff of the campus of Ravenna. Actually, the Ravenna is a bit far from Bologna, so it's not that we can go back and forth every day, but also we are kind of independent here for what possible, not full independent, but kind of independent, especially to solve the problems. So, and then there is an administrative staff here from the secretary, the student office and the secretaries delivering the diploma, signing. You will, I think you will have it right now. So it's already in the hands of Stefano, if not in yours, so the certification for the graduation. So this happens because there are many people really motivated to work with us, and they of course tried their best to help Wacoma, because Wacoma is a peculiar degree course, laurea magistrale. So I think everybody here spent a lot of energy to help us. So I have the occasion to thank Emanuela Fabri. She's the head of the office taking care of teaching activities. And of course, Stefano, we mentioned him many times, and I know that he will remain in your memories because of the great help he gave to me, but also he gave you. And so, and I see here the representative of the municipality, so thank you for coming. And then I think we just may send our thankful message to everyone here who followed us, the speakers and the people still here, and the administration and the partners. Someone, as you have seen from the talks, they were very helpful, not only for hiring our students, but also for the internship. This has been great by the associated partners. So thank you, and I stay in touch. We try to be helpful in the future, but I want to follow your successes. Thank you very much.